So the question is, what is a heart attack? Well, the coronary arteries are the blood vessels that supply blood to the heart. They're named because if you in your mind turn that heart upside down, the coronary arteries sort of surround the heart like a crown. And that's what coronary means. The heart attack occurs when one or more of these blood vessels becomes completely blocked, depriving the heart of its blood supply. And if that's not corrected, it can lead to death. Your heart is an amazing organ that does a fantastic amount of work for you. Every day, the heart beats about 100,000 times and pumps over 2,000 gallons of blood, depending on how active you are. And if you realize that 1 gallon of water weighs about over 8 pounds, you realize that that's a lot of work the heart is doing. Now, this is a video showing you what blood flow looks like when it's flowing through our blood vessels normally, when there's not a lot of fat in our bloodstream. You can see the red blood cells are flowing unimpeded. They're moving very quickly, delivering nutrition and oxygen to our cells. But after we eat a high-fat meal, those cells become very sticky. They sludge in our blood vessels, and that slows down the delivery of oxygen and other nutrients to our blood vessels. And when that happens in the brain, it can lead to sleepiness, mental fogging, and in severe cases, if the blood starts to clot, you can get a stroke or a heart attack or some other problem. So you can see that flow does not return to normal until about 10 hours after a high-fat meal, when all that fat has been cleared from our bloodstream. So what is a heart attack? Heart attacks don't occur immediately. They're not sudden events that take years to develop. The first step is an injury to the lining surrounding that lines our arteries. And over time, you get cholesterol and fat deposited at the site of that injury. And that blockage builds up until it becomes so critical, it closes off most of the lumen of the blood vessel and makes it makes it very difficult for blood to get through. And that's when people can develop what's called angina, or pain coming from the heart when they try to exercise and the heart can't supply itself with extra blood. And then blood that has to flow across that blockage speeds up. It's just like when you stick your thumb over the opening of a water hose, it causes the water to speed up, or the blood to speed up, but that blood flowing faster across that blockage creates shear forces that can actually cause that thin cap of tissue to peel off and rupture. And then once that happens, the body treats that just like it does when you peel off some of the skin from your wrist or elbow. It will form a blood clot at that area to try to repair the damage. But again, if that occurs at a site of narrowing, that blood clot itself can block off that artery, thus depriving a portion of the heart muscle of its blood supply. And that is what a heart attack is. So again, as I said, when the plaque becomes very large, it limits blood flow to the muscle. Just keep your eyes on the picture, and you can eventually get angina. And then if the plaque ruptures, you get a blood clot formation that will block all blood flow downstream. And that portion of the heart is then subject to dying if that clot is not cleared. So if blood flow is not restored to the heart in less than 6 hours, all of the affected muscle will die. That's why all of the therapies that are used for treating acute heart attacks are designed to remove the blockage, either by dissolving the blood clot, which is what aspirin does. And that's one reason why I want to say I do not like it when people say that aspirin treats heart disease. No, it doesn't treat heart disease. The disease is caused by the diet and the deposition of fat, cholesterol, and garbage in our arteries. What aspirin can do is help stop that terminal event, or that blood clot that forms and blocks off the already narrow artery, but it doesn't do anything to reverse that blockage or prevent additional fat and cholesterol from being deposited. And that's why nowadays, if you start to show symptoms of a heart attack, they will rush you into the cardiac cath lab, where they will thread a catheter into that blocked artery and insert what's called a stent, or a wire cage, to force open that blood vessel and hopefully restore blood to that injured muscle. And that's why they talk about the golden hour, because if it can be done within an hour, they can actually prevent any of the heart muscle from dying. But as it progresses beyond an hour, more and more heart tissue will begin to die off. Studies show that populations consuming plant-based diet are at much lower risk for developing heart disease. Healthy plant-based diets benefit our hearts by being low in total and saturated fat, but high in the heart-healthy types of fat like mono and polyunsaturated oils. Plant-based diets are also higher in fiber, plant proteins, antioxidants, and contain little or no cholesterol. If you're vegan, vegetarian vegans typically have cardiovascular risk profiles that are well below those of people who eat meat. They live longer, have lower body weights, lower blood pressure, lower levels of homocysteine, and cholesterol levels that can be 100 to 150 points below people who habitually eat meat.